Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, here's a troubling statistic. According to the Centers for Disease Control and Prevention, 1 in 4 women will experience severe physical violence by an intimate partner during their lifetime. Now, domestic violence involves violence or abuse by one person against another in a family or an intimate relationship. And domestic violence, of course, isn't limited to just women. It can happen to anyone, regardless of age or gender.
In fact, over 3 million children each year in the U.S. experience or witness abuse at home. Here to discuss domestic abuse is Denise Morcom. Denise is a licensed social worker at Mayo Clinic with more than 15 years of experience working with victims of domestic violence and abuse. Welcome to the program, Denise.
Thank you. I'm happy to be here.
Denise, good to see you. I know that this is a huge problem, and we're glad to have someone on the radio to talk about it. But I guess before you can intervene or help someone, you actually have to realize or recognize that there is a problem. So how long has it been that it was deemed appropriate to ask people if they feel safe at home?
I think it was the 1980s when we began educating the medical professionals to always ask during visits whether they're safe at home or not, safe to return home.
Was it something that was, I think the first time I was ever asked this, I was just kind of surprised. Is it surprising to patients?
Well, I think they've become more used to it now. I kind of remember the first time I was asked to, and it was surprising, but I thought in a nice way.
And how often do you get a positive response?
Boy, I'm not exactly sure about that, but given the frequency of it,
And how frequent? When
well,
you
like
say
30%, I think it's like 30% of women are currently in abusive relationships, and so, but they hesitate to disclose it even to medical professionals, so it's still got a lot of stigma attached to it.
It certainly, as we said in our intro, it could be children or it could be, men. It doesn't matter. It doesn't make any difference. What about the growing abuse of elderly abuse?
Yeah, it certainly is an issue, and many of the shelters are now reserving beds for elderly patients as well. I've also worked in hospice, and so it's certainly something we paid attention to and saw a significant number where family members are taking financial advantage of elderly or physically neglecting them or abusing them.
There's lots of things that are included here. Physical, emotional. The financial one is one I had not thought of. When it's with a partner, with a significant other, there's sexual abuse that can be part of it.
Absolutely.
Is there any of those that is more common than another that you're usually working with patients, or are they just all over the board?
Well, they are all over the board, but I would imagine the emotional and verbal are most prevalent and then least identified because people don't always self-identify that as abuse. But when it becomes physical, even then they don't identify shoving or tripping or restraining as abuse either. Many people wait until it's a punch in the face or threatened with a weapon to actually identify it as abuse. So you really have to do education rather than just say, are you being abused? Because probably 70% of them would think what they're going through isn't abuse.
If they're waiting to be hit, that's
Yes.
there's a lot of space in between there.
But when you ask the question, do you feel safe at home, don't you think most patients take that to mean, are they being physically abused?
Yes.
But there is this segment of that population, abuse population, where it isn't physical abuse, it's sexual or emotional. Is that in fact more common than physical abuse?
The emotional and verbal is more common, I would say, and sexual abuse, hopefully, the least common, but still very prevalent.
So how do these patients get referred to you, and how do you determine, what questions do you ask to figure out that there is in fact a problem?
Well, I can answer that two ways. My history with domestic violence was working in shelters, and so that's a very specific population in and of itself. most of the population has resources that would allow them not to end up in a shelter. Middle class and upper class women or men are also abused, but they have credit cards, they have friends, they have relatives, they have coworkers, and it's who we see in the shelter are more often poor people with multiple issues.
And it's interesting. I guess it's good that when you go to a Mayo Clinic or to your healthcare provider that they ask this question. So how does domestic abuse affect your overall health? Obviously, that's why a healthcare provider is asking the question.
Sure. So they can, one easy way to tell is frequent visitors, so multiple injuries. They receive double the medical attention that the average person would. So it's headaches, it's blatant injuries like broken bones, broken fingers, bruises, but they have more stomach issues, more headaches. They'll have mental health issues, chemical health issues, depression, anxiety, or call it, I'm having some relationship issues, or yes, I'm under stress. So the beginning of it can be very vast. And so it's really the follow-up questions by the provider that gets down to more specifics. And then building that relationship over time builds trust. And they may say no the first time, but maybe the third or fourth time they start to disclose more.
So when a patient is referred to you, how does the interview proceed? What questions do you ask them?
Well, if providers, the doctors, are suspicious of abuse or something doesn't seem quite right, they will make a referral to the clinical social workers on staff, and then we do a psychosocial assessment. So we do more of the relationship building and talk about their finances, their health, their relationships, their support systems. Just kind of open the door that way. And they will, and I even start to define abuse. So I never say, are you abused? I say, has anyone hit you? Do they call you names? Are they angry a lot? Can you tell me more about the stress in your relationship? So kind of broaden it out more.
And then once you determine that there is in fact abuse in the relationship or with another family member, what do you do?
Provide further education, kind of empower them that they shouldn't be treated that way. I understand that they love or care about their partner. Are they willing to bring their partner in for some counseling? Do they know that there's shelters available, that there's orders for protection that they can get if they want to leave?
And as we're wrapping up here, what should you do if you suspect that someone that you love or you work with, or someone that is a victim of some abuse?
Yeah, it's very difficult because, as you've probably heard, the statistics are like they leave 7 times before it's actually over. And so you want to stay a friend and an advocate to them and not give them ultimatums like, if you don't leave him, don't talk to me, because that just further limits their resources. So again, you provide support, encouragement, resources.
All right, and what about if you yourself feel that you're a victim of abuse?
You can reach out to therapists, social workers. There are shelters in virtually every community or not too far away. And there really is this wonderful network, at least in Minnesota, called Day One, where all the shelters communicate with each other every day about open beds, so that if you make a call to a shelter, they can get you the police or a taxi and actually get you to a shelter, and then they'll find an open bed for you and start the process of
All right, difficult work that you do, but we're so glad that you do it because there's so many people who need your help. Yes. Difficult topic, domestic abuse, from Ms. Denise Morcom, licensed social worker, Mayo Clinic. Thanks so much for being with us.
Thank you for having me.